to have that off of me? Y'all, I never thought I would learn so much about viruses in my life. Okay, yeah, I'm an assistant professor in a school of public health, but I was trained as a psychologist. But now, just like many of you, I think I've earned my honorary doctorate from Google in virology. So what is a virus? Well, Oxford defines it as a harmful or corrupting influence. It's capable of copying itself and harming other people, and it changes over time. It's transmitted in 4 modes: direct, indirect, airborne, and vehicular. And there are 2 main ways to treat it: through prevention, like with this mask or a vaccine, or an intervention, like a ventilator. Oh, just one more thing. What if I told you that the virus I'm referring to isn't about 6 feet of space, but how we handle race? The virus of racism, much like COVID-19, harms individuals and groups, can be copied between people, especially in the same house or community. It's transmitted in 4 modes: direct, indirect, institutional, and structural. And we have certainly watched it evolve in the United States to become a part of our DNA. That means that it's gone beyond a pandemic. It is now endemic or persistent to our nation. Racism is especially harmful to children. Since children can't make sense of the bad germs or terms coming from adults, they are more susceptible to the actions and beliefs. But racism doesn't impact children the same way. Much like COVID-19, some children may experience severe symptoms requiring life-saving care, while others may not feel any symptoms at all, even in the same house. But whether we can see it or not, racism destroys its targets. And targets are often Black children who experience racism at greater rates and more frequency. We're talking 5 incidents a day or more. Racism can impact children's self-esteem, sense of belonging, and relationships, or more severe symptoms like depression, anxiety, or PTSD. So knowing what we do and how viruses harm children, how can we treat the virus of racism? Well, we can also utilize prevention and intervention methods to stop and drop the impact of racism in our communities. The great state of Michigan and national public health organizations have declared that racism is a crisis, so we gotta meet a public health problem with public health solutions, y'all. It's time to roll up those sleeves. If we want to beat the virus of racism, we must first admit that it is here and it is harmful. When the US government denied the pandemic in March 2020, they directly contributed to hundreds of thousands of deaths that could have been prevented. We know that viruses are harmful and deadly. So rather than deny its existence, let's devise our resistance. Anticipating racism allows us to better see, feel, and do something about this social virus so that we can stop its circulation. Secondly, in the same way that tests alerted the infected and those around them to the presence of COVID-19, assessments are crucial. We can do it through different modes, like a therapist and her client, teachers and their students, hospitals and their pediatric data, and cities and their policies. We can all assess and redress racism. For example, in Detroit in the 1940s, children living on one side of the lawfully constructed 8-mile wall were victims of less education, less services, and financial ruin, while those on the other side benefited from this discriminatory policy. To the Detroit government, what can we do today to bring down this wall to prevent another disparity between downtown and the rest of our city? For the virus of racism that's already in the air, one of the best ways that we can address it is by talking to our children. I study racial socialization, or the talk that parents and other close adults have with children about racism to protect them from harm. Socialization allows us to drop-kick racism with families and communities because we're able to prepare our children for the harm and help them heal from what they've already experienced. Now, some adults might think that talking to children about racism will make them sick, but it actually helps them breathe easier and relieve their stress. My work with hundreds of families indicates that the talk leads to better mental health outcomes, not just for children, but for parents, teachers, and therapists. But some parents may be nervous about having that talk with their children, and y'all, that makes sense. But what's most important is to remember that your actions can equip children to be more confident and courageous to fight against and overcome this virus. We can have healthier communities for our children, but we have to be brave enough to experience the sting first. So how can we be so brave? How can we courageously eradicate this social virus? Well, we've talked mainly about challenges with denial, data, and discussion. So I want to provide 4 recommendations for getting us to those strategies. From misinformation to truth, in the midst of backlash toward critical race theory from parents and politicians, we must acknowledge what was and is broken to work toward racial repair. From lack of information to resources, seeking education at a variety of levels will allow us to reduce our own fear while finding better resources for our children to protect and prepare them. From hesitancy to agency, while there may be initial discomfort in getting the vaccine, the long-term outcomes will help us to empower our children and have better racial climates for them. And finally, from limited to limitless. Aren't you tired of being sick? Liberating ourselves of the constraint that racism is here to stay allows us to envision a future for our children free of this dis-ease. While vaccines are on the rise in the United States for adults and children, we are breathing a long-awaited sigh of relief. Yet, racism continues to spread through institutions and relationships, causing many to hold their breath and some to prematurely breathe their last. We know that viruses are harmful, so what can we do to get rid of the racism in our communities? We must seek limitless strategies so that we may seek these prevention and interventions that have agency, education, and truth, and that are centered on families and communities. We can beat the virus of racism, so let's put our masks on first to filter out hesitancy and helplessness so that we can create safer communities for our children. Thank you.